Hi, Catherine. It's Caro Overdulve here with my subject Christian. And today we're going to test for dysfunction in the sacroiliac joint, otherwise referred to as the SI joint. And the reason that we're doing the test for dysfunction in the SI joint is to rule out that there's any dysfunction in the SI joint that would be causing back pain. So I'm going to be doing 3 tests. I'm going to do the finger Fortin test, the Gillett's test, and the standing forward bend test. But normally for someone, and I'm going to be testing to see if we can get positive tests, and that will determine what course of action I'll prescribe to Christian. And so the first test, ultimately the best way to determine whether or not there is a positive test is to take a cluster of tests. There's a cluster of 5 tests that was recommended that I learned from my research. It was the distraction test, the compression test, the thigh thrust test, the Galen's test, and the sacral thrust test. And for a positive, we need to have 3 out of the 5 tests be positive. And one of the 3 tests that are positive have to be a thigh thrust test or a compression test. So the first thing I'm going to do is I'm going to do the Fortin finger test, and I'm going to ask Christian to point to his pain. And then I'm going to ask him a couple questions to distract him from his pain, and then I'm going to ask him again to point to his pain, and just to be sure that there's a coherency with his location of pain. So Christian, can you please show me your pain, where it hurts? Okay, so he's showing it in his lower back area. Now I'm going to ask him a couple questions that are unrelated to his pain. Okay, Christian, what did you have for breakfast?
Cereal.
And what type of cereal was it?
Cheerios.
Okay, and can you point to your pain again, please? So there we go. So now we have a positive test for the Fortin finger test. So now we can go on to the next test to determine whether or not the SI joint is causing his pain. So the first thing I'm going to do is I'm going to palpate for his iliac crest. And actually, maybe we can just go like this, and I'll show you can see it better in the video. Hopefully that'll give you a better angle, Catherine. Okay, so I'm palpating with my right thumb, iliac crest, and I'm feeling his PSIS, his posterior superior iliac spine. And with this left thumb, I'm palpating onto his S2 vertebrae. Now I'm just going to ask him to flex his hip up to 90 degrees. Okay, and one more time. And my thumb is going downwards, okay, downwards and inwards towards me. Positive test would be that if the thumb on the PSIS does not move posteriorly, or basically does not move in, but rather upwards, and my thumb moved down on his PSIS, so that indicates that it's not a positive test. And the third test we're going to do is called a standing forward bend test. So what I'm going to do is I'm going to ask Christian to kind of, actually I'll just go this way. Okay, and again I'm going to palpate for his iliac crest. And then I'm going to basically find his PSIS. And I'm going to ask him to slowly lower his chin and slowly lower down to the floor. And what I'm looking for is to make sure that my thumbs are moving anteriorly at the same rate. A positive test would be if one of my thumbs on either side is moving at a different rate than the other one. So try it again. But right now my thumbs are moving at the same rate. So again, I said a positive test would be if one thumb was moving and the other wasn't. Or if there's gaps, or if one stays in the exact same place and the other one doesn't move. Come on up. So we can see from these 3 tests, the finger Fortin test showed that he did have some pain. The Gillett test didn't provide a positive test, and neither did the standing forward bend test. So that indicates to me that yes, there is potential dysfunction there, but I'm not ruling out. I'm not necessarily advocating for the fact that he has dysfunction is causing his back pain. So what I would do at this point is I would send him to a chiropractor or a physiotherapist or even a GP that would start him on the way to getting examined and getting him into the system, maybe to see an orthopedic surgeon if it so warrants. So, and then my job would be to basically do the rehab exercises that are prescribed by the medical professionals, and go from there to help him overcome his pain. Okay, so that's pretty much it about the SI joint, the tests that were used to determine an ASI dysfunction, and so that's it. So I'll see you later. Have a great day, and talk to you soon. Thanks.
Bye bye.
Just a second, Catherine. I'm just showing you.